In September 2025, a remarkable collaboration took place in Chennai, India. Dr. Luong Kim Chi, a leading neonatologist from Vietnam, arrived at Saveetha Medical College and Hospital. Her mission: to share expertise, to train healthcare providers, and to strengthen the practice of Immediate Kangaroo Mother Care, or iKMC. This visit marks a milestone in advancing neonatal care, uniting India and Vietnam with one shared goal: saving newborn lives. Dr. Chi was warmly welcomed by the leadership of Saveetha Medical College. In discussions with the dean and senior faculty, both sides emphasized the importance of implementing iKMC as a standard of care. The leadership expressed their vision clearly. Our goal is to ensure that every newborn delivered at Saveetha has the opportunity for skin-to-skin contact from the very first moments of life. These conversations laid the foundation for a stronger partnership and mutual learning. The visit continued with a detailed tour of Saveetha's world-class hospital facilities. The institution operates with more than 1,600 beds, including over 100 intensive care beds, of which around 25 are dedicated to pediatric and neonatal intensive care. Each day, the hospital manages over 5,000 outpatients, reflecting both its scale and clinical capacity. Inside the NICU, Dr. Chi observed advanced monitoring systems and family-centered models of care. The Comprehensive Lactation Management Center, equipped with a human milk bank, stood as another vital resource supporting newborn survival and breastfeeding success. A faculty member emphasized, "We want our students and doctors to see how evidence-based practices like iKMC can be fully integrated into modern facilities like these." This tour highlighted how robust infrastructure, advanced technology, and innovative practices combine to improve neonatal health outcomes. In her lecture, Dr. Chi outlined the latest WHO guidelines. She explained that iKMC must begin immediately after birth, even before the baby is stabilized. Her presentation covered 3 key elements: proper infrastructure, staff training, and family support. She concluded with a strong reminder: iKMC is not just a medical intervention. It is a human right for every newborn. To highlight the real impact of iKMC, Dr. Chi presented success stories and clinical outcomes from Tan Anh Hospital in Luong An Province, Vietnam. At Tan Anh Hospital, Immediate Kangaroo Mother Care is applied to every newborn, without exception. This includes full-term babies, premature infants, and those with low birth weight. Over the years, the hospital has seen a remarkable transformation in neonatal outcomes. Clinical data show that survival rates among low birth weight and preterm infants have improved significantly since iKMC became standard practice. Many babies weighing under 1,800 grams, who were once considered at high risk, are now surviving and developing normally. Hospital records demonstrate a clear reduction in neonatal infections, hypothermia, and complications related to prematurity. Beyond survival, developmental outcomes are equally encouraging. Babies receiving iKMC show improved breastfeeding success, steady weight gain, and better temperature regulation. These improvements have lessened the reliance on incubators and reduced the length of hospital stays, making neonatal care more cost-effective and sustainable. For the medical staff, iKMC has become more than a protocol. It is a culture of care. Nurses, doctors, and midwives at Tan Anh have embraced this practice as a daily routine, integrating it seamlessly into both delivery wards and neonatal units. These success stories provided the Saveetha audience with powerful evidence. iKMC is not just feasible in well-resourced hospitals, but also highly effective in district-level hospitals. With commitment and teamwork, it can be scaled anywhere, ensuring that every newborn has the best chance to survive and thrive. The training also addressed critical situations in the delivery room. Not every newborn cries and breathes immediately after birth, and in such cases, rapid and skilled intervention is required. Dr. Chi emphasized the importance of antenatal counseling for mothers before delivery. Mothers should be informed about skin-to-skin care, exclusive breastfeeding, and when needed, the steps that the healthcare team may take to stabilize the baby. This preparation reduces anxiety and builds trust between the family and the medical staff. During the demonstration, mannequins were used to practice basic newborn resuscitation with bag mask ventilation. Participants learned how to Position the newborn's head in a slightly extended, sniffing position. Ensure airway patency and a good mask seal. Deliver ventilation at the correct rate and pressure. Monitor chest rise and adjust technique immediately. Dr. Chi highlighted that teamwork is vital. Doctors, nurses, and midwives must work seamlessly. While one person provides ventilation, another monitors the baby's heart rate, and others prepare emergency equipment or support the mother. Each role is essential, and coordination saves precious seconds in those critical moments. Equally important is preparedness. The training stressed the need for meticulous preparation of delivery rooms, ensuring all resuscitation equipment is present, functional, and checked before every birth. Warm towels, suction devices, bag and mask, oxygen supply, and KMC binders must be readily available. By integrating resuscitation skills with iKMC, the training underscored a complete continuum of care. Stabilize the newborn when needed, and as soon as possible, transition to skin-to-skin contact, breastfeeding, and nurturing touch. Asterisk, the training then transitioned into a comprehensive, hands-on module where theory was transformed into practice. This was not just a demonstration, but a step-by-step immersion in the essential skills required for neonatal care. Using mannequins, Dr. Chi carefully demonstrated the correct technique of Immediate Kangaroo Mother Care, iKMC, following the latest World Health Organization guidelines. She began by explaining why positioning is the foundation of iKMC. The newborn must be placed upright between the mother's breasts, with the head slightly extended to keep the airway open, and the face always visible to ensure safety. The baby's arms and legs should remain flexed in the natural frog position, which promotes comfort, stability, and proper development of the hips. Dr. Chi emphasized that the baby should be secured gently but firmly with a binder, ensuring both safety and comfort, while mother and baby are covered with a warm cloth or blanket to maintain thermal stability and prevent hypothermia. Beyond positioning, Dr. Chi highlighted the integration of iKMC with early initiation of breastfeeding. She explained that keeping the baby skin to skin while guiding the mother to breastfeed within the first hour after birth stimulates oxytocin release, enhances milk production, and establishes exclusive breastfeeding. This practice provides not only nutrition but also antibodies that protect against infections, while deepening the mother-infant bond. The training module then expanded to include nurturing practices that complement iKMC. Dr. Chi introduced newborn massage as a low-cost, evidence-based method to support circulation, enhance digestion, improve sleep quality, and further strengthen bonding. She demonstrated gentle strokes along the baby's arms, legs, back, and abdomen, explaining how daily massage stimulates growth and neurological development. Participants were actively engaged throughout the session. They were invited to practice the entire sequence on mannequins, positioning the baby in the correct iKMC posture, securing with a binder, simulating early breastfeeding support, and performing gentle massage. Each step was supervised closely by Dr. Chi and the facilitators, ensuring precision, safety, and confidence. Participants were encouraged to correct each other, fostering teamwork and reinforcing the importance of communication in real delivery settings. The module concluded with a powerful reminder. iKMC is not an isolated action, but part of a comprehensive continuum of care. Resuscitation when needed, warmth through skin-to-skin, early and exclusive breastfeeding, and nurturing touch through massage all form an integrated system that ensures survival, growth, and healthy development. This holistic approach, when practiced consistently, transforms neonatal care from mere survival into thriving. Asterisk.
Each participant then had the opportunity to practice carefully under direct supervision. Step by step, they positioned the baby on the mannequin, secured the binder, simulated early breastfeeding, and performed gentle massage techniques. Instructors provided immediate feedback, correcting hand placement, posture, and breathing support whenever necessary. The training environment encouraged active learning, where participants not only repeated the sequence multiple times but also rotated roles, acting as the provider, the observer, and the supporter, to strengthen teamwork. This close supervision ensured accuracy in every movement and built confidence to apply these practices in real clinical situations. By the end of the session, participants expressed readiness to integrate iKMC, breastfeeding support, and infant massage into their daily practice, knowing that precision and safety are the foundation of effective newborn care. Next, the training advanced into the delivery room, where theory and mannequin practice were brought into real-life application. Participants worked alongside mothers and newborns, applying immediate kangaroo mother care directly after birth. Doctors, nurses, and midwives collaborated seamlessly. One guided the mother on positioning, another ensured the newborn's airway was clear, while others secured the binder and provided warm coverings. The atmosphere reflected both professionalism and compassion, as the team supported mothers in their first moments of skin-to-skin contact. One doctor reflected, "This is my first time practicing iKMC in real delivery care. It is simple, yet so powerful. Seeing how quickly the baby stabilizes on the mother's chest has changed the way I think about neonatal care." The delivery room became more than a clinical space. It was transformed into a place of bonding, survival, and mutual learning. Participants not only gained skills but also a deeper appreciation of how evidence-based, low-cost interventions can make the difference between life and death for newborns. This practical experience strengthened their confidence to integrate iKMC into routine delivery practices, ensuring that every newborn receives the best possible start in life.
This training was more than just a workshop. It was a shared journey of purpose and dedication. Doctors, nurses, and midwives stood shoulder to shoulder, learning side by side, exchanging knowledge and building trust as one team. Beyond the skills, what emerged was a powerful sense of unity. Together, they pledged to move beyond routine practices and embrace immediate kangaroo mother care as the gold standard for neonatal care in Saveetha's hospital. The commitment was not individual but collective, a promise from the entire team to every newborn and every mother who walks through their doors. This spirit of collaboration is what transforms training into long-lasting change.
In closing, Dr. Chi expressed her deepest gratitude to the leadership, faculty, and staff of Saveetha Medical College and Hospital. Their openness, collaboration, and dedication made this training a true success. This partnership reflects not only professional growth but also a shared vision for healthier futures for newborns everywhere.
This training is only the beginning of a global journey. Across nations and across hospitals, we are united by one mission: to ensure that every newborn has the chance not only to survive, but to thrive. Immediate kangaroo mother care is more than a method. It is a commitment of love, science, and humanity. Together, we can make it the standard of care, everywhere, for everyone.